Break. We were talking to Kandi Pickard. She's the CEO of the National Down Syndrome Society, and you're talking about a new grant that's going to help out, and we're hearing about folks living with Down syndrome living longer, and this grant is supposed to help out. Tell us about it.
Absolutely. So we're really excited. We're launching our Care Down Syndrome Initiative, which is a clinical education and resource hub for healthcare professionals.
So what do you think the general public still misunderstands about adulthoods or adults living with Down syndrome?
Absolutely. As you mentioned, the livelihood of an individual with Down syndrome is now people are living into their 60s and their 70s, where, in the mid 80s, they were living into their 20s and 30s. And so we're trying to bridge that gap in healthcare needs for our adults with Down syndrome. And that's where CARE is a solution to be able to do that with healthcare professionals.
Yeah, you spent years advocating for this community. What stories from the adults with Down syndrome struck you the most?
Absolutely. I think what we're seeing is that there's a lack of understanding of the needs and the unique healthcare needs of individuals with Down syndrome and adults with Down syndrome. About 5% of individuals with Down syndrome have access to specialty care clinics that truly understand the unique needs of individuals with Down syndrome and their healthcare, uniqueness that comes into that. And so this tool is a way for healthcare professionals to be able to educate themselves on the needs of the people that they're serving in their local communities.
What about families as well? When you make that transition from a child living with Down syndrome to an adult, what are the gaps there, or are there any?
There are. I think we see a lot of times that healthcare professionals, I look at my son, he's 13 years old, who has Down syndrome. At some point in time here, we're going to have to transition to an adult provider versus a pediatric care provider. And I think what we see is a lot of times our adult physicians or primary care providers may not understand those unique needs, as I mentioned, about our adults. And so this educational tool is a way to be able to give healthcare professionals more education on what they need to look for within adults with Down syndrome.
And what would that be, especially when it comes to adults living with Down syndrome? What are those things that you need to recognize early?
Yeah, it's a great question. I think what we're looking at is we're seeing a lot of things around regression disorder, even as our aging population looks into Alzheimer's disease is a piece that we're learning a lot now more about around the correlation of Down syndrome and Alzheimer's disease. And so those are just two, very unique types of pieces that we just need to educate our families, as you mentioned, but also those providers.
Yeah, we hear this is this is the last question for you. The $1.7 million grant, what will it allow your organization to do that you haven't been able to do before?
Yeah, it's for us, it's really bridging this gap in healthcare. I think we did this survey, last year, and this is what our families are needing, and our families are really wanting to advocate for better care for their loved ones.
All right. Thanks so much, Kandi Pickard. Thanks so much for joining us. Really appreciate you being with us.